The way you protect the child from COVID-19 infection is no different from protection for yourself. Important thing is washing your hands regularly, using hand sterilizers, wearing a mask all the time, or ensuring that the child is not exposed in public places, and maintaining social distancing between people. No, the children with neuromuscular disorders are not more prone, but if they have compromised respiratory problems or they have cardiac issues, which is not uncommon as they get older and older, those children are more prone to develop COVID-19 infections. Therefore, those are children you need to be very careful with. So if someone has a fever, cough or cold at home, it's better to isolate that person away, particularly away from these children with neuromuscular disorders, as these children are certainly, if they do develop the infection, the severity can be more, and therefore one needs to be careful to isolate these children away from the person who has got affected and assume that they may have COVID-19 infection until the test reports come. Vaccine has been approved for 18 years and above at present. The children with neuromuscular disorders should have the COVID-19 vaccine because it helps to prevent these children from developing COVID-19 infections, and that is very important in these cases. Child with Duchenne muscular dystrophy, if they're on steroids, should not be discontinued suddenly, as abrupt withdrawal can cause problems for the child, and it is important that they continue with their regular medications, be it steroids or calcium or whatever supplements they're on, and they can proceed to go ahead and have the COVID-19 vaccine. The brand of vaccine does not matter, but it's important that we follow the advice of the manufacturer / the Government of India on how many doses at what weeks separation they should be given. If your child is COVID positive, the same principles as in other people should be followed. That is isolation of the child, even while waiting for the results of the COVID test come back. If the child has respiratory compromise or cardiac compromise, then those children should be taken to a physician to be assessed and taking a decision on whether hospitalization is essential or not. No, the steroids should not be stopped. As I said before, abrupt withdrawal of steroids medications which a child has been on for many years will cause problems for the child, and therefore it should be continued along with other medications. Whatever medications that your physician or doctor prescribes may be continued along with this. Regular breathing exercises helps a lot in clearing the secretions from the respiratory pathways, and that includes things like pranayama. Your physiotherapist would have advised you about how to do deep breathing exercises in the child, and that is important for them to continue regularly, at least 2 or 3 times daily, in order to clear the secretions from the respiratory airways. And once that is done, the chances of picking up infections is a lot less as compared to others. Your local physician is the best person, so keep in touch with a local doctor whom you can contact in an emergency, because particularly in this scenario where hospital beds are scanty, it's best that your local physician starts treatment or advises you on what to do next, and starts treatment early. So do keep in touch with your local physician regularly.